I'm Dr. Allison Errol Ryan, a pediatric specialist in Sunnyvale, and we're here to talk about the flu. What is the flu? The influenza virus is an upper respiratory viral infection which primarily infects the nose, the throat, and the lungs, and this is where we primarily see the symptoms. How is it different than the common cold? They are both very similar. The major difference is the timeline of symptoms. The history I normally get with the common cold starts off very mild, very progressive, one day just a little sniffle, then a cough. With the flu, it happens so rapidly. You're fine one day, the next day your symptoms appear. Out of the blue it seems. So that's the major difference between the influenza and the common cold. Flu could be a severe illness, and the best way to protect yourself is to get the vaccine, especially if you are immunocompromised, chronic medical illnesses, you're around young infants that cannot get the vaccines just yet, or you're around a pregnant female or anybody else who has a chronic medical illness who would end up in the hospital with severe complications. The main bottom line is to avoid complications from the flu. This is why we should get the flu vaccine every year. Who should get the flu vaccine? Anyone 6 months and older who qualifies for the flu vaccine should get the flu vaccine. Specifically, certain members of our population who might be at increased risk, more vulnerable to the flu, should get the vaccine, such as children less than 2 years old, elderly more than 65, pregnant women, and anyone with chronic illnesses that will put them at increased risk for severe disease. How do you get the flu vaccine? Now, the first place to check it is your doctor's office or clinic or your PCP, and most pharmacies as well. If you're still having trouble finding where to get a flu shot, you could check the link provided on the screen. Flu shot is for everyone, and you should try to get it and where available. The side effects of the flu vaccines are typically they're mild. You can have soreness of the arm. Some people have a little bit more, like muscle aches, fevers, body aches, and chills. Any severe illness, you're advised to go to the emergency department to get your symptoms evaluated. Can you get the flu after receiving the flu shot? Yes, you can get the flu after receiving the flu vaccine, but you're less likely to end up with severe symptoms requiring the emergency room or hospital visit. So it's very much still advisable to get the flu shot every year to prevent severe illness from this virus. After getting the flu vaccine, the best way to stay protected is to follow all public health guidance, such as staying home if you're sick, covering your cough, washing of hands, maintaining good social distancing, and disinfecting services if the needs be.